In this video, I'm going to show you how to decompress your knee for instant pain relief. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. So in this video, we're going to do traction pulling motions into the knee to decompress or take pressure out of the knee joint. So if you're dealing with knee arthritis, just general aches and pains, this is a video that might give you quick relief, even in as little as 30 seconds. As a bonus, all of these exercises are easy, effective, and can be done in the comfort of your own home. So let's get started and get rid of that knee pain right now. In the first part, we're going to focus on decompressing the knee using no special equipment other than a towel, and in this first exercise, a bed. Let's start off on all fours just like this. Our feet are going to be off the edge of the bed. I find that using shoes makes this exercise a little bit easier because you can grip and it offers a little bit more comfort too. So whatever side that we're focusing on, let's hook that side's ankle right at the edge of a bed. So it's a nice stable anchor point. What I'm going to do from there is just shift my body just a little bit forward like this, including the other side's knee, so I can get into a lunge stance. When we have that stable anchor point set with the ankle, what I'm going to do is then lean forward into it like this with my body weight. This will straighten out that side's knee. What you want to do is keep going forward until you start to feel tension, a traction pulling motion happen into the knee. Keep going forward until you feel a very comfortable stretch. This should not cause discomfort. If it does, please discontinue immediately. You want to hold this position for 15 to 20 seconds. From there, you can relax, take a breather, and then repeat this up to 5 times. With each repetition, drive your body weight forward even more to get a better stretch. From there, you just want to switch to the other side to make sure that both are kept in balance. So here is a really easy, effective way to get traction or decompression into the knee using just a rolled up bath towel. It's a two-part process. In the first part, let's just focus on getting pressure out of the knee as quickly as possible. This one's really good for knee stiffness, achiness, and arthritis. I'm going to lay flat. The side that I'm focusing on, let's have that knee bent. The other leg is going to be straight just like this. I'm going to grab below the knee, right on the shin. My foot is going to be flat. And from there, I'm just going to bring the heel, slide it back towards my butt as much as I can. Once we hit a very comfortable stretch, let's hold this for about 10 seconds. From there, just slide a little bit forward to relax it, and then repeat this one up to 5 times. When you do this, go a little bit further with each repetition to get a better stretch. But you just want nice, slow, even motions to help decompress that knee. In the second part, what we're going to do is we're going to take our towel, place it on the back side of the knee. We're also going to take the foot, slide it inwards, the toes inwards just a little bit, and then get back into that same position that we did earlier. When we slide the heel back towards our butt, what we're going to notice is that the towel is going to create a bigger wedge with this exercise, allowing us to get a better traction stretch into the knee. So again, only to your comfort level. With this one, once we hit that point, we can hold this for an extended period of time, up to 30 seconds if you feel comfortable. But when you're ready, just take a breather by just sliding forward a little bit and then repeating this one up to 5 times. It is normal to get a pop or click while doing this exercise. That is completely normal with the stretching motions. It's just gas being released from the joint. But once you're done on one side, always switch to the other to keep them both in balance. This is one of my personal favorite ways to decompress the knee because it usually ends in a satisfying pop, crack, or self-release. This one is best done at the edge of a bed, but you can also use a sturdy chair, one without wheels, depending on your height. So let's go to the edge of a bed. The side that we're focusing on, let's bend the knee just like this, and then we're going to take the foot and we're going to hook at the edge, right at the ankle. This will create a nice stable anchor point. The other leg is going to go straight. Let's start with very good upright posture, just like this. The movement from here is very easy. We're going to take the butt, even more so over the sit bone right here, lower it down towards the heel. Allow gravity to take our body weight. And when you do this, the further that you go down, the more that you're going to feel it open up into the knee. So go very, very slowly with it to begin with. Once we hit a very comfortable stretch into the knee, one that's not causing discomfort, let's hold this position for at least 15 seconds. But you can hold it for longer. You can do 30 seconds, 45 seconds, 60 if you do feel comfortable, because it's just going to allow pressure to be taken out even more. I tend to get an immediate pop or crack when I do this myself because it does reduce pressure very quickly. If that does happen, that is completely normal. It's just gas is being released through normal, or I should say natural stretching motions. But once you need a breather, come back up, and then you want to repeat this one very slowly for 3 to 5 repetitions. With each repetition, try to allow gravity to take the body weight down even further to get a better decompression stretch into that knee. And once you're done on one side, always switch to the other to keep them both in balance. So here is another great knee decompression exercise that you can do at the edge of a bed. And with this one, it's going to hit the meniscus, or the padding in between the knee, a little bit more. What I do, whatever side that I'm focusing on, let's bend the knee, put it up on the edge of the bed like this. The foot is going to go forward like this to hook at the ankle to create a stable anchor point. I'm going to take the towel, I'm going to roll it up lengthwise like this, and then pull the 2 ends forward and hook behind that knee. You want a lot of built up tension during this exercise. This is a 2-part motion. The first part, what I'm going to do is I'm going to take my arms, go straight at the elbow like this, and lean forward into it with my upper body weight. When you do this, it should feel like the towel right here is pulling at the back of the knee. That's going to create the first part of our traction per se. Really focus on that tension. What we're going to do from there is take the sit bone, the spot that we sit on our butt, and then go straight down towards the heel. This will intensify the stretch. And I don't know if you heard it, but I got a nice self-pop already into the knee. Only go to your comfort level. You really want to focus with this one in a nice straight line too. That sit bone going straight down towards the heel while you pull forward with the 2 ends right here. Once we hit a very comfortable stretch, hold this one for 15 seconds, but you can hold it for longer, 30 seconds, 45 seconds, whatever you feel comfortable. When you need a breather, just kind of relax for a second, and then on the next repetition, use your upper body weight to pull these straps forward even more, and then lower your butt down towards the heel to intensify that stretch to decompress it even further. You want to do this for 3 to 5 complete repetitions. And then once you're done on one side, always switch to the other to keep them both in balance. In this part, we're going to focus on banded traction to help decompress the knee and hopefully do all the hard work for us. I'm going to use a pull-up band. You can get these locally at a sporting goods department. You can also get them online. If you would like to get them online, I will leave a link in this video's description. What I'm going to do is take a hand drying towel and tie a knot at one end of the band and place it underneath the door. Make sure the knot is big enough that it won't slip underneath the door. That way it will have a nice stable anchor point. It won't come back to whack us. Once we have the strap secured on the other side of the door, let's take the strap, place it on the back of the foot like this, and then cross the 2 ends over like this. This will create a very stable anchor point over the foot so it won't slip. I'm also going to use a can of soup for this, and you'll see why here in just a second. I'm just going to slide back from the door. What this is going to do is create initial tension at the knee. You should feel it pulling towards the door. Slide back as far as you feel comfortable. Once you hit that point, let's just lie back like this and place that can of soup underneath the knee to help bend it. This helps relax the knee just a little bit more and it will target it better. So you want this nice and relaxed. The more you relax, the better this will work. What I'm going to do from there is just kind of push back a little bit more to intensify that traction. Once we hit a very good spot with that stretch, let's hold this for about 30 seconds. From there, you just kind of relax by sliding forward, and then you want to do this for about 5 complete repetitions. If you do feel comfortable, you can hold this for a longer period of time. Grab a book, use your iPad, anything like that, just take your mind off it and let this band do all of the hard work. But again, every so often, kind of press back just a little bit further to help open it, and when you need to relax, just scoot a little bit forward. This knee decompression exercise is what I like to call the rolling chair method. We just need an office chair, one with wheels. I'm going to take the band this time around, loop it around the doorknob on the other side of the door, close the door so it's nice and sturdy. Let's loop the band around the foot again like this, and then cross over very similar to what we did in that first exercise. What I want to do is position my leg in a nice straight line with the band, so the traction is going to be pulling in a very, very straight line. From here, I'm just going to slide back until my leg is lifted up from the pull of the band and my knee is going to be just slightly bent. The further that you go back, the more that you're going to start to feel that traction being built into the knee. So only go to a very comfortable traction stretch. Once we hit that position, hold this for about 30 seconds. You just want to relax as much as possible. When you need to relax, just kind of come forward, take a breather, and then from there, try to do 5 complete repetitions. With each repetition, slide back just a little bit further to help take more pressure out of the knee. You can also hold this one for an extended period of time. A minute, 2 minutes, grab a book, grab an iPad, anything that will help take your mind off of it. But it's just a good way to allow this pretty much rolling chair motion to help take tension out of the knee in a very simple way. If you got a lot of relief, please show us your support by giving this video a like and maybe subscribing to our channel too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thank you for watching.